Hi everyone. In this video, we'll be discussing the symptoms that you notice or you see when someone has colorectal cancer. You will notice in our previous videos, we discussed the asymptomatic group of people who have colorectal cancer. But in this video, we'll be discussing symptoms of patients with colorectal cancer. The most common symptom that we find in people with colorectal cancer is abdominal pain. Now, the abdominal pain comes because of the obstruction of the tissue or the mass within the colon. Sometimes that mass too could bleed, and when it bleeds, they could be passing blood in stool. They could also have incidences of weight loss because of the tumor necrosis factors or the substances that tumor releases within the abdomen. Another important symptom that they could have is a change of bowel habits. And with this change of bowel habits, we're talking about the fact that the person may have some degree of constipation with diarrhea. How that happens is this: because of the obstruction of that mass within the bowel, the stomach, the abdomen, the intestine, as the case may be, there is a pool of feces because of that occlusion at that place. The person may experience some constipation at that point. Now, when that pressure builds up and the person is able to now, the obstruction is bypassed, then the person will have what he would describe as diarrhea. That is the change in bowel habit. Now, there could be some difficulty in passing stool if the mass or the lesion is within the rectal area. Now, it's also important that we mention some other symptoms that could be indicative of late or advanced diseases. That could be the yellowness of the eyes, the yellowness or the deep coloration of the urine, the pain in the upper right abdominal region of a person, which could most times indicate a liver affectation. It could have low back pain, which most times could indicate the fact that the tumor has spread to the backbone, and they will have instances where the person may not be behaving as you would expect the individual to behave on a normal basis. In the medical parlance, it could be called brain metastasis. Now, it's important for us to know that in all of these symptom presentation, that the individual must present in the hospital nearby, a government hospital or a private hospital, where he or she can be adequately evaluated and be sent to an appropriate oncology center for treatment. Thank you very much for the time. Please remember to like, to share, and to follow us for